Welcome. My name is Dr. Inbar Young. I'm a licensed clinical psychologist in the states of California and Ohio. I wanted to spend a few minutes talking to you today about my theoretical style and approach. There is a lot of misunderstanding of what is psychodynamic psychotherapy. Psychodynamic therapy is really insight-oriented and depth therapy. People who work with me are usually those who like to peel the layers and to figure out why they are the way they are. They tend to be insightful and introspective. When I went to grad school, there was a heavily focus on the cognitive behavioral model. The model that really look at how our thoughts, our cognition, impact the way we feel and the way we are. So I definitely see myself as an integrative provider, and I often utilize those skills to really help clients alleviate symptoms. However, those who choose to work with me are not satisfied with just symptoms relief. They really want a lasting change that comes from within. Psychodynamic work is heavily embedded in feelings work. We slow down. We listen to verbal and nonverbal communication styles. I look at your body language. I look at your tone of voice. I look if what you say matches what you're trying to convey. And more importantly, I pay attention to what you avoid talking about. I look at how you solve conflict. I look if anger is readily available or really internalized and repressed. And there is a huge emphasis on the therapeutic relationship. That space between us can really help foster change. We call it corrective emotional experience, when you trust the provider you're with, when you can just let go and be. In that space, you hopefully can find yourself. I see myself as a generalist. I see people with depression, anxiety, bipolar spectrum disorders, life transitions, grief, relationships, with a focus on trauma and PTSD. Trauma does not just refer to veterans with combat experiences or those who have had sexual or physical abuse. Trauma is also for those who have experienced emotional neglect. On the surface, you may feel you should be feeling great. You have nothing to complain about. But internally, you may feel isolated, detached, and lonely. I conceptualize heavily from attachment and interpersonal theories. I see myself as a warm and direct provider. I'm going to ask you lots of questions, only so I will get a general understanding of why you are the way you are, where you're at, and where you want to go. I believe that you are your own expert. So I'm not going to tell you what to do. I really feel that my role is one of a trusted guide that just helps you uncover what is buried or forgotten but was there all along. I hope that gives you a little understanding of who I am as a provider and whether or not I will be a good fit for you. Thanks for listening.